Well, it's now just 39 days since the surgery on my left foot, and I'm back at work. I can't express how impressed I am with the speed of recovery. Fantastic surgery. I want to recommend it to anybody who's thinking or having second thoughts about doing it. Don't hesitate. I saw some pretty gruesome stuff on YouTube beforehand, and I was quite nervous. So I want to counteract some of that with my superb success story. So this is the intro. I'm just going to show you very shortly the 2 feet alongside. They were very much the same, both severely deformed, and the left one, as I said, I'm back in shoes as of about 1 week ago, and I'm able to walk comfortably 2 miles. I'm able to cycle up to 20 miles without any hassle whatsoever. So life is just wonderful. The foot is still a bit swollen, but that is pretty normal and to be expected, I'm told, for 3 to 6 months. Although again, if the rate of progress is anything, so far as anything to go by, it could even be quicker than that. Wonderful stuff. So first of all, here are the feet in the 2 new shoes. The left one is the one that was operated on, and you can see immediately 1 week of wearing in the shoe has perfectly retained its shape, whereas the foot on the right, the shoe is already distorted, and in fact it was distorted within a few hours of being put on the foot. And to think that all these years I used to just have to accept distorted shoes like this. Wonderful success story. So there we have it. The foot on the left obviously is the one that's been operated on. Toe is well able to wiggle. The foot on the right is the one that still is to be done. So just to see how extremely deformed they were. That's the one on the right now. And the one on the left, still quite swollen, but you can see the scar actually is a comparison with some of the ones that are available for you to look at on YouTube. Is remarkable, really. That's 39 days since the surgery. The hammertoes were quite severe, and again pretty excellent, really. So go for it. So it's now the morning of the 1st of June, and I've just got up, about to have my bath and prepare for going to the hospital for the operation. I'm due to check in at 7:30, and I hope I won't have too long to wait after that. And so hopefully within 5 or 6 hours from now the operation will be complete, and the first big step will be underway. The kind of feeling of a little bit of tension and anxiety I've had over the last few days is kind of given way now to a kind of more determination feeling and a bit of good expectation that all will go well, and I just want to get on with it. If anything, yesterday was a confirmatory feeling, because I did a day of 4 hours probably standing on my feet during a day at the Rotary Duck Race in Swindon. And I have to say that at the end of about 4 hours or so, both my feet in the area across the metatarsals were extremely painful, and only by walking around did I ease the pain, either that or of course sitting down. But basically just standing still for 4 hours was very uncomfortable. So this is a foot that's going to be operated on today. Close up. So hopefully next time we video this, it's going to be in a sparkling new condition. So this is the foot from another angle, and I'll just move around so we can have a last look at those twisted toes before they're all changed. That's it. So this is episode 2. It's now day 2, just coming up to 7 p.m. or so. I'm glad to say that everything is going really well. Today I've had
the whole day, really lying on the sofa. I'm lying on the sofa bed. I'm lying with my leg propped up on 3 cushions, and by I guess about middle of the afternoon, the last of the residual effect of the local anaesthetic is wearing off, and it's now become quite clear that painkillers are essential. Obviously, I've been assuming they're essential, but by personal experimentation, it seems to me that in my case, about 4.5 hours is all I can tolerate before taking the next pair of cocodamol tablets. But they are working absolutely fine. The pain I've got is a bit more than discomfort, I have to say, but it is certainly not agonizing pain or anything like that. The whole foot is tingling. There's no localized pain in the area, obviously, where the incision took place, but it's just a general discomfort in the foot, and as I said, perfectly tolerable with the tablets. When I go to the loo, at the moment I haven't used crutches. I've just been linked along by Charlotte and holding along to the furniture as I go to the loo. I've been able to eat comfortably. I don't have much of an appetite, but certainly I'm eating meals, very light meals or sandwiches, and able to drink mugs of tea and drink water. So all going well. Let's hope it keeps on like this. Roll on, full recovery. So that's the shoe, and you can just see the prongs sticking out from the 2 small toes. But the nice thing is you can actually see toe number 2, which has been out of my view, or shall I say the toenail of number 2, it's been out of my view for many years, and now I'll be able to see it looking down vertically. Hurrah!
Hello again. Well, it's now day 3, that is 48 hours plus about 1 since I was released from hospital. So this is the first movement I've had outside, just going to the loo. So to update, the most important thing is the pain is nothing like as bad as I had been fearing, and when I've got my foot up and resting, as it is at the moment obviously, and has been all the time with the 48 hours, but particularly like this morning, I used painkiller at 6:30 and again at 1, and the time at 1 was just because I wanted to be able to walk out here. So all in all, it's, I wouldn't say pain-free when I'm resting, but it's almost, and certainly it's totally comfortable. Now when I walk, it's a different thing. The crutches we only got them yesterday evening, so I used them for the first time last night, and getting used to them is not that easy. But when I am walking with the crutches now, the pain has become fairly localized to where I imagine the incisions and whatever the consultant has done in that area. I can just starting now to be aware of what presumably is an incision above about toe 3, but I got no awareness of any particular wound in the big bunion area. That is a pleasant surprise. So all in all, I'm delighted with how I feel, much better than I was mentally preparing myself for. And to be honest, now I'm going to need lots of projects to do, of which this is just one, to keep myself from being bored, because with just 48 hours over and presumably another 26 days to go, feeling as good as this at this stage is fantastic. And obviously I'll be finding lots of things to do and acting from the director's chair. So this is the way I've got to rest. I'm just pretending that I'm on holiday, enjoying the bird song, the wider view,